It was all about trying to ensure that 46 million people who had no health insurance in the US could obtain it for the first time, that healthcare was no longer a privilege, but a right for all. It was all about trying to stop people going bankrupt due to huge hospital bills. And it was all about putting an end to what were seen as the worst practices within the health insurance industry. The Affordable Care Act, or Obamacare, was Barack Obama's signature policy, his main priority in office as he battled to get the highly divisive bill enshrined into US law. Republicans hated it, one even branding it the most dangerous piece of legislation ever. But in an historic vote, it was first passed in the US Congress in 2010 and then signed into law by Obama himself.
This year, insurance companies will no longer be able to drop people's coverage when they get sick. Or place They won't be able to place lifetime limits or restrictive annual limits on the amount of care they can receive. Today, I'm signing this reform bill into law on behalf of my mother, who argued with insurance companies even as she battled cancer in her final days. I'm signing it for Ryan Smith, who's here today. He runs a small business with 5 employees. He's trying to do the right thing, paying half the cost of coverage for his workers. This bill will help him afford that coverage. I'm signing it for 11-year-old Marcellus Owens, who's also here. Marcellus lost his mom to an illness, and she didn't have insurance and couldn't afford the care that she needed. So in her memory, he has told her story across America so that no other children have to go through what his family's experienced.
In its original form, the law forced all Americans to subscribe, something many refused to even contemplate, and it forced insurance companies to accept everyone. But the companies found ways to pass on the financial burden to clients by rising premiums and deductibles. Despite that, its popularity has grown, with more people now supporting it than being anti it. It's meant that 20 million more Americans do have health insurance, although 28 million still do not. Republicans still hate it. They've tried to block the law more than 70 times in Congress and tried several times in the Supreme Court. The latest attempt right now, as the court looks again at whether Obamacare is even constitutional. Well, Ryan Thompson, Valerie Defer and Romain Janny revisit Obamacare for France 24.
Five o'clock in the morning, and though the sun has not yet risen, dozens of cars are fighting for a spot in line. Dina has arrived before dawn to be sure that she can see a doctor.
Do we really have appointments, or are we first come? Do they just tell everybody?
You do really have an appointment.
This is Pahrump, a small rural town in the U.S. state of Nevada. The high school here has been transformed into a free short-term field hospital. As the COVID-19 pandemic devastates the community, hundreds have come for free medical care.
What time is your appointment at?
5:45.
Okay. Have you had a fever in the last few days?
Nope, I stay home.
Worsening cough?
No, well, I've got allergies.
Okay.
Inside, Dina spends the early hours sitting patiently. The wait time to see a gynecologist is close to 4 hours.
My insurance went up so high. When they renewed, I had the health insurance marketplace. I don't know what they call it, the Obamacare or whatever they call it now. I don't know what it's called, but I had that, and it went up. It almost doubled this past year, and so I couldn't pay for it anymore. So I've had no insurance at all this year.
Down the hallway, the gymnasium has been converted into a large dental practice. Mark drove 7 hours from Arizona and spent the night in his car waiting for treatment. After his consultation, this veteran can barely speak because 6 teeth were removed by the volunteer dentist.
You came from far away, right? Can you tell me from where you came? Phoenix.
In the world's most powerful country, over 45,000 people die each year from lack of medical care.
They may have insurance, but they have an unexpected expense come up, and they're forced to choose between paying their bills paying their mortgage and getting their dental care. So that's where we come in.
Pahrum's free clinic is treating 500 patients per day. The goal is to keep people healthy and prevent costly medical complications in the future. These types of clinics were supposed to disappear with the passing of Obamacare. But 10 years after the law was enacted, 40 million Americans remain uninsured.
The yeas are 60, the nays are 39. The Patient Protection and Affordable Care Act is passed.
March 23, 2010, then U.S. President Barack Obama signed the Affordable Care Act, often nicknamed as Obamacare. It was the most ambitious reform of the American healthcare system in the country's history.
Today, after almost a century of trying, today, after over a year of debate, health insurance reform becomes law in the United States of America.
But contrary to how it sounds, Obamacare is not a public health plan, but a private solution, the result of negotiations and compromises with powerful insurance companies. The law requires all Americans to purchase insurance or face a fine. This is called the individual mandate. As part of the deal, companies are required to insure every citizen, even those with a complicated medical history. It's a small victory that's allowed more than 20 million Americans to benefit from guaranteed coverage. Stephen Martin was once a very active young man. He was the captain of a swim team until his life changed 5 years ago after a routine blood test.
I was at school and I got a phone call. It was my nurse from the clinic. She started to get panicked, and then she said, "You have elevated white blood cells." And I knew that meant that we were looking at cancer, and it was awful.
He was only 30 years old, and doctors had diagnosed him with an aggressive form of leukemia.
Yeah, my doctor casually mentioned that my medicine was expensive and that it was $146,000 a year. I thought I had my whole life ahead of me, and that price just took my full future away.
But because of Obamacare, Stephen's costly treatment was covered in full.
This is all the medicine I take to stay alive. Got inhalers, antidepressants, chemotherapy, acetaminophen.
The law guarantees affordable health insurance for the 50 million Americans with chronic illnesses. Conditions like cancer, diabetes, high blood pressure, and heart problems are all covered without question.
I'm inextricably linked to this law. If it was not for the Affordable Care Act to give me the insurance, I would not have the medicine and I would not be here.
Like Stephen, the majority of Californians have access to subsidized health insurance. But in the rest of the United States, access to care varies dramatically, especially in politically conservative states. For 10 years, Republicans have been on a crusade against Obamacare.
Liberty, yes. Tyranny, no.
They've tried to repeal the law over 70 times in Congress. And since taking office in the White House, Donald Trump has made it a priority.
We will never let socialism destroy American health care.
Their strategy: unravel Obamacare little by little from its core. First, lifting the requirement that each state extend Medicaid, the public health care assistance program. Then, cancel the individual mandate and end the obligation for Americans to have health insurance.
Make no mistake, this is a repeal and a replace of Obamacare. Make no mistake about it.
The result? Obamacare has been emptied of its landmark changes. Texas, like 13 other Republican states, refuses to apply all the provisions of the law. Years ago, Destiny started feeling sick.
Around the time that I turned 30, I suddenly woke up with a stomach virus, and everything changed. I recovered from the initial stomach virus, but symptoms continued to grow.
Doctors diagnosed her with an incurable genetic disease, which would require intensive and costly treatment.
This was all of the appointments and testing that I was able to get in Louisiana that I didn't have to pay for out of pocket. That was covered by Medicaid.
Provisions of Obamacare helped expand the Medicaid program, which provides health coverage to people with low incomes. Like Destiny, an additional 15 million Americans have benefited from the public health care.
I don't know what you're pointing at. When I got sick, I had the opportunity to go immediately to seek help.
Gradually, her condition deteriorated, and Destiny could no longer live on her own. A year ago, she moved to Texas to be closer to her family. But since then, her life has become complicated and costly. Texas refuses to apply Obamacare and expand the Medicaid program, unlike Louisiana.
I certainly find it tragic and overwhelming that anyone should have to go through that. It's just disappointing to be in a society where that can happen.
The move meant Destiny had lost her medical coverage, and now treatments and medications would cost between 500 and several thousand euros each month.
I'll sit here and watch you. Watch you. I had to pick and choose which specialist I could see with the little money that I had. Our life is in limbo. My life is at a standstill until I can get the help that I need.
Destiny's situation is far from unique. The state of Texas counts the most uninsured residents in the entire country. Republicans want to return to a loosely regulated private system. Robert Henneke is one of the lawyers who led a Texas lawsuit that ruled the Obamacare requirement to purchase insurance was illegal.
The architects of the Affordable Care Act created the individual mandate under the idea that requiring everyone to have health insurance would bring in the revenue necessary in order to offset the high cost of the Affordable Care Act. That concept, first of all, is unconstitutional in the United States for the federal government to command people to purchase a product that they do not want.
But in response, California's top prosecutor decided to step in and appeal the decision before the U.S. Supreme Court in Washington. The case of California versus Texas is evidence of the deep ideological divide in the United States.
Even if by chance the court finds that the individual mandate is unconstitutional, the rest of the law, the protections against pre-existing conditions, the protections for seniors, the protections for adult children, all of that should remain. America is beginning to learn what it means to have health care as a right. And I don't believe any American, especially during this pandemic, wants to lose the right to have access to health care for their children.
The coronavirus pandemic has hit the world's first superpower hard, with 250,000 dead and more than 10 million Americans infected. In Republican states where Obamacare has been rolled back, getting treatment for the virus is not always easy. Frank DeOro narrowly escaped a severe bout of the virus after being hospitalized here for 5 days.
I had already started coughing. I was having phlegm with blood, and that was part of the COVID pneumonia, but I did not know that until I came over here to the hospital.
Ironically, Frank is an insurance salesman, but his employer does not provide him with medical coverage, and to save money, he has chosen not to subscribe to Obamacare.
And the day of when I was like, all of this paperwork happens to provide, so like all the medical things that they provided to me here at the hospital, as far as like with oxygen, for medication, things to go ahead and help combat COVID-19.
And so all this ended up costing how much?
About $24,000.
It's a burden that Frank will undoubtedly repay his entire life. He's particularly at risk, diabetic, and suffering from heart problems. Every day, he has no choice but to take about 10 drugs. But without insurance, Frank seeks out a charity clinic for a less costly treatment.
How's it going? It's going good. Okay, I can go ahead and pick up some medication. Yeah.
Here, the prices of care and medication are based on the income of each patient.
So one of these medications that happens to be for my diabetes, it can range anything uninsured from $400 to $1,000.
And if you come here, how much are you going to pay?
I believe this one I could be getting it at $15.
U.S. drug prices have increased by 30% in 10 years, largely due to no regulation.
Just because you have insurance doesn't mean it's affordable. You still have to pay your co-pays, you still have high deductibles. So places like us will always be there because sometimes you might have good insurance, but your deductible is $10,000.
To offset the additional costs insurance providers face because of Obamacare, many companies have increased their deductibles. Some are as high as 12,000 euros for a family of 4. Healthcare remains a lucrative business with overvalued prices.
Patients often come to us and say, how come when I was with this insurance company, my medicine only cost this amount, and now I'm with a new company and it costs this amount? And I say, well, that's the negotiation that your insurance company does with the pharmaceutical industry. So yes, medicine, we don't like to think of it as a business, but sometimes there are parts of it that certainly are.
Still, Obamacare has changed the lives of millions of Americans like Stephen. And now, the Supreme Court must decide its fate.
Are we a country that leaves people behind? Or in the richest nation on earth, do we start guaranteeing people the right to live? I just know that on my side, I stay alive. On the other side of this argument, I don't live. I am a product of its worth. My life was saved because of this law.
The law is on borrowed time, even as 40 million Americans like Frank are still uninsured, and even as the COVID-19 pandemic rages. With the election of Joe Biden, hopes of expanding public health coverage have been reborn. And 10 years on, Democrats want to keep their promise to offer health insurance that's accessible to all.
Valérie Defer, Ramon Jani and Ryan Thompson revisiting Obamacare for France 24. That's all from this week's edition. Don't forget, of course, you can catch it and the previous editions as well on our website at france24.com. Thanks for watching.